News that isn't surprising, but still shocking nonetheless. Health Canada has officially declared an influenza epidemic. An epidemic is marked by early and unusual flu activity. In the last reporting period, ending November the 5th, there was an 11.7 test positivity rate, an increase of more than 6% in 2 weeks. And it's children who are the most impacted. 64% of all illnesses have been reported in kids up to 19 years old. So this map from Health Canada illustrates the areas with widespread flu activity in dark purple. Part of southern Alberta, the entire top of Saskatchewan, southern and eastern Ontario, and New Brunswick are all reporting surges in influenza cases. With me to discuss is Dr. Marla Shapiro, CTV's medical contributor. Dr. Marla, good morning to you. So we knew flu season was happening earlier than usual this year. Now Canada is in a flu epidemic. Tell us more about what this means and what changes now in the way we respond.
So we've been predicting this for quite some while, looking at what happened in Australia and their outcomes. And we've really been encouraging parents, particularly of young children, 6 months and up, everybody actually, to get a flu vaccine. This means that we've got this tridemic of RSV, flu, and COVID happening, and prevention is so critical, along with all those mitigation methods that we know that we have learned for now the past 2 years.
So with rising cases of the flu, RSV, and COVID-19, as you point out, we have been tracking the surge in patients at children's hospitals across the country. But many parents are still unsure, Dr. Marla, about when to seek help for their children. Of course, many people are concerned about visiting an overcrowded hospital right now. What's your advice?
Yeah, and that makes good sense. The first thing I really want to reiterate is that if you haven't had a flu shot, get a flu shot. So many of my young adults will say, I don't get the flu. I'm not worried about getting the flu, but you can transfer the flu to someone else. As a parent, what you want to look at is how ill your child is. For any child under the age of 3 months that has a fever, that typically means an emergency room visit. Children that are in really difficult respiratory distress, you really are concerned about your child breathing, or your child is not as responsive as you would like to see, or you're very concerned about them being seriously ill, then that usually means an emergency room visit. But for the vast majority of children, typically watch them, try and keep their fever down, hydrate them. If they hit a fever of 72 hours, it's time to see somebody like me. If they've had a fever and the fever stopped and the fever's come back, then it's time again to see a healthcare practitioner. And you really want to make sure that you're able to hydrate them and that they're, not eating as much. That's typical to see, but you want to make sure that their behavior is in keeping with what you normally would see and that it doesn't ring those alarm bells for you. And lastly, ear pain for more than 2 days is another good reason to come see someone like me.
What was your reaction to the masking guidance from Ontario's top doctor yesterday? Do you think it went far enough, that recommendation to wear a mask in public spaces?
Frankly, no. And I know that nobody wants to go back to mandates. And I know that everybody wants there to be a normal school year. And we want to think that this is endemic right now. But right now, we're sitting in this triple threat that's happening right now. So if you can put an either later to put, a mask on your child, then that's not a bad thing to do at all.
All right. And before we wrap up, what are some of your other tips that we can all use to stay healthy during this flu season?
First and foremost, it's always prevention. We're going to think about social distancing. We're going to think about those mitigation strategies, certainly wearing a mask in areas that are crowded. Remember to sneeze into your sleeve. All of those things that we were talking about 2 years ago, remember them. Wash your hands well. Assess the situation and the background noise of what's happening in your community. And again, those extra layers of protection are something that you can do for yourself.